Bismillah Rahman Rahim. I am Dr. Mohibullah Wazir, and the topic is the vagal nerve palsy, 10 cranial nerve palsy. Now, if you properly know the branches of the vagus nerve and the areas supplied by it, then it would be easy for you to understand the palsy of the vagus nerve. Look, the first branch of the vagus nerve that is given to the ear, external ear, and external auditory meatus center, peripheral brain. So sensation, the first point, vagus nerve palsy, sensation in the external ear and auditory meatus, it will be lost. Second branch is the pharyngeal branch, and the pharyngeal branch of the vagus nerve, it supplies the muscles of the pharynx as well as the muscles of the soft palate. So, what will happen if the vagus nerve damage? The constrictor muscle of the pharynx involved in swallowing that will be affected. So, difficult swallowing, or patient would not be able to swallow. This is one point. Secondly, because the soft palate during swallowing it passes upward to close the posterior nasal aperture. If the soft palate is paralyzed, then when you ask the patient to drink water, it will regurgitate through the nose. So nasal regurgitation of fluids and the difficult swallowing, that is the pharyngeal branch of the vagus nerve is damaged. So when the pharyngeal branch is then damaged, so in addition to difficult swallowing and nasal regurgitation, there will also be loss of gag reflex. That is when you touch the pharynx, and then the sensation and the movement of the soft palate will not be able to the patient the soft palate will not move with the when you touch. This is the gag reflex will be lost. So loss of gag reflex is also one of the sign of the vagal nerve palsy. Then through the laryngeal recurrent laryngeal nerve and external laryngeal nerve and superior laryngeal nerve, the vagus nerve supplies the larynx. That's why if the vagus nerve or the branches of the vagus nerve or the vagus nerve by itself is damaged, and what will happen if the recurrent laryngeal nerve, superior laryngeal nerve, if this is damaged, then there will be loss of sensation in the larynx, and then the laryngeal muscle will be paralyzed. And what will happen? There will be hoarseness of voice, very slow pitch voice, or change in the voice depending upon the damage, or it may be nasal tone. And you would note that the tone or the speech of this patient is not normal. And then thirdly, if you come lower down than the larynx, because it supplies the heart and the lungs, then there will be then changes in the heart rate and in the blood pressure, also because of the damage of the vagus nerve. Then the vagus nerve supplies the upper end of esophagus as well. That's why there will be also difficulty in swallowing, because the upper end of esophagus is the skeletal muscle and supplied by the vagus nerve. And then lower down, the lower part of esophagus, the stomach, the intestine, small intestine, these all being supplied by vagus nerve. There will be again the movement of the intestine and the stomach will be reduced, and then the secretions, acid secretion, because parasympathetic is secretory motor as well, that will also be reduced. So there will be difficult or weak digestion, bloating and distension of the abdominal viscera, and also the nausea and vomiting may occur because of the problem of the vagus nerve. And then in some people there will be appetite loss as well, because when the movement of the intestine, the stomach and secretions are all being reduced, the appetite will also be decreased. And that is also called as old manure, because if you stimulate the vagus nerve, the intestinal motility and secretion increases, and the appetite of the old man increases or improves. That's why the appetite will also be decreased. Okay, these are the different signs and symptoms of the vagus nerve palsy, which you will note, and I hope it will be clear for you and easy for you. Thank you very much. So when the pharyngeal branch is then damaged, so in addition to difficult swallowing and nasal regurgitation, there will also be loss of gag reflex. That is when you touch the pharynx, and then the sensation and the movement of the soft palate will not be able to, the patient the soft palate will not move with the, when you touch, this is the gag reflex will be lost. So loss of gag reflex is also one of the sign of the vagal nerve palsy.